coming up.
It's already been mentioned, you recently returned from the World Health Assembly. I understand that the World Health Assembly and WHO has embarked on writing a new treaty on control of infectious disease.
This Guy's Garage. Like and subscribe.
Mr. Duclos, I hope you're feeling okay. I understand that you've recently been diagnosed with COVID, so thank you very much for being with us.
I think, or it seems to me anyhow, part of managing the ongoing COVID pandemic and especially avoiding further need for shutdowns is doing better at getting out therapeutics for the treatment of COVID. Certainly, studies have shown Paxlovid to be quite effective if given early to high-risk people in preventing progression to more severe disease. Now, I think in the SUPs there is some extra funding for therapeutics. Can you tell me more about that in terms of how much money and for which therapeutics?
Well, thank you very much, Dr. Polowski. Yes, Paxlovid has been a remarkable drug until now, as we know, and as you know more than most people. The initial clinical evidence was strong, and it's been increasingly available in clinical settings across Canada. It started a bit slow because provinces and territories initially found it, let's say, a bit challenging to, as it always happens, to make sure that the drug was available in the right places. But we can be very proud of the outcomes that they have achieved in the last few months. Added to that is Evusheld, which is another therapeutics which is more particularly available for vulnerable populations who may not be able to respond well to COVID-19 vaccines. That's also something very good from a clinical, but certainly from a social public health perspective. And we have other tools in our toolkit that we're hoping to bring forward.
In the amount of money which we've put towards therapeutics?
Well, in total, we have budgeted $2 billion and for the range of treatments, and that includes, as I said, Paxlovid and other possible drugs that have been, fortunately and remarkably, developed quite quickly, and with, in some cases, with very good results.
And Evusheld, is that now approved by Health Canada? Because I know, and it is, I think, being pretty widely used in the United States for people that, for one reason or another, can't take Paxlovid because they're taking other drugs which interact with it or have renal failure or on dialysis. Is that, can anyone, either yourself, Minister, or anyone in the department, tell us whether that has been approved yet by Health Canada? And if not, when do we expect it may get approval?
Maybe I should turn to Dr. Lucas immediately, who may then turn to another official.
Mr. Chair, Evusheld by AstraZeneca was authorized by Health Canada on April 14th of this year. And the Government of Canada has purchased treatment courses that have been distributed to provinces.
Okay, thank you very much. On a totally different subject, Minister, I know you've, and it's already been mentioned, you recently returned from the World Health Assembly. I understand that the World Health Assembly and WHO has embarked on writing a new treaty on control of infectious disease and also on revisions to the international health regulations. Maybe you could tell us a little bit about what you found with respect to what WHO is doing in improving global health governance to try to prevent in the future further pandemics like this, or if there are pandemics, making us better able to respond to pandemics on a global level.
Thank you very much. I'll answer in two different pieces. First, on COVID-19 and a very important related issue of which you know quite well, the antimicrobial resistance issue, which has been a key element of the discussion at the WHO and prior to that at the G7 meeting. So on both of these, we need a better ability to share data and to coordinate actions across the world, in particular in development of vaccines and therapeutics. The second piece is around climate change. We spent quite a lot of time at the G7 meeting, in particular speaking about what we increasingly know to be the terrible impact of climate change on the health of Canadians and the health of others, but also on the impact for our healthcare system, to make our healthcare system more resilient to the impact of climate change in our country and across the world.
Any further?
And thank you, Minister. We've now reached the